Hello there, I'm Dr. Khalid Karim. I'm a Senior Clinical Teaching Fellow at the University of Leicester and work for Leicester Partnership Trust in England. During this video I want to explore with you the management of children with autistic spectrum disorder. It first should be acknowledged there is no cure for autism, and therefore the management tends to be on reducing the stress of the children. Now, to reduce the stress of child with autistic spectrum disorder, it is important to understand all the elements which are affecting the child, which can be considerable. But as a rule of thumb, it is useful to recognise that children with autism are generally anxious. And anxiety is the driving feature behind a lot of their behaviours, and when the child becomes anxious, it leads to anger. So again, it's useful to recognise that when a child with autism is getting angry and aggressive, this is probably a reflection of the anxiety they are feeling in the situation. Now, it's very easy for a child with autism to become anxious. They become anxious mainly because of changes in their social environment, or they may not understand what's happening to them, or a change in their routines. Now, the change in routine can be fairly small rather than a major change, and it's how the child perceives this change which is the important thing to consider. So if we're thinking about what causes anxiety, again, think about social difficulties, communication difficulties, and their need for rigid routines, and look at with anything which affects these areas. In addition, I would consider looking at the levels of sleep the child has, because they often have sleep problems. Are they hungry? Are they in pain? And anything that is causing the child some irritation. Most people find that having a fairly clear routine for the child does help, and also giving them visual prompts of what is going to happen in the future or during the day, such as the use of what we call visual timetables, either pictures or diagrams, what's happening, and remembering that they don't respond very well to verbal instructions. So I would tend to avoid verbal instructions, focusing very much on visual strategies. Try to see it from the child with autism's perspective, and this will help reduce their anxiety and general stress levels.